So good morning. We're here today to talk about a new call center we've launched. I'm sure that's a huge surprise to all the members of the media who are with us. To make it easier for residents who are 75 and older to schedule a vaccination appointment. We'll also talk about a new public awareness campaign that aims particularly to build trust around the COVID-19 vaccine, especially with communities of color and other key populations. But first, I want to give a quick update on COVID-19 cases, hospitalizations, and vaccinations. Yesterday, the Department of Public Health reported 2,602 new cases out of 81,286 new tests. That continues a trend that's been going on for several weeks here in terms of the reduction in our 7-day weekly number of new cases. Nearly 14 million tests have now been administered in the Commonwealth. 1,554 individuals are in the hospital with COVID, 335 are in the ICU. The hospital trend obviously continues the trend that has been going on now pretty much since the start of the new year in terms of a pretty significant downward trajectory with respect to COVID cases in the hospitals here in Massachusetts. Vaccines, yesterday's vaccination dashboard from the Department of Public Health indicated that 681,472 doses have been administered to residents, which is up from about 496,000 doses administered in last week's dashboard. And these doses were then distributed to mass vaccination sites, pharmacies, community health centers, and other providers so that they can continue to do this critical work. And in total, over 1 million doses have been shipped to providers across the Commonwealth. Yesterday, there were 55,000 new appointments added to the mass vaccination sites for next week. In total, over 120,000 new appointments were added at clinics across the Commonwealth. As of this morning, there are still 20,000 appointments available for next week at the 3 mass vaccination sites at Gillette, Fenway, and the Eastfield Mall in Springfield. 20,000 appointments still available next week at Gillette, Fenway, and Springfield. There are currently over 125 public vaccination clinics in Massachusetts, and we expect that number to ramp up to 165 by the middle of this month. Today, we're launching a new call center, as we said before, for individuals who are 75 and older and unable to access the vaccine appointment website to make it easier for them to schedule a vaccination appointment. We've continued to make improvements to mass.gov/COVID vaccine, the website where people can make reservations directly, but we recognize that the call center will be a better option for many older adults who may not have someone to help them book an appointment online. The vaccine scheduling resource line will be open Monday through Friday from 8:30 a.m. to 5 p.m. It will be accessed via 211, and there will be over 500 representatives staffing the line who can provide live phone support to 75-plus residents who can't use mass.gov/COVID vaccine. Live call center workers will be available who can speak both English and Spanish, and will have translators available to support residents in about 100 additional languages. This resource is aimed at helping residents 75 and over access an appointment. Call center workers will have the same access to appointments that users will see if they go to mass.gov/COVID vaccine. The call center won't be giving individuals additional access to appointments that are not otherwise available. They'll just be able to help people access appointments that are available in locations that are convenient for them. Residents who can't use the website can access, as I said before, the call center dialing 211 and selecting the prompt for help with scheduling a vaccine appointment. We expect this call center, certainly today, will experience very high call volume, so you may have to wait a bit in the line until it settles and starts to spread out. Once you're connected to a representative, residents will be asked to confirm that they are 75 or older and that they have trouble using the website, and call takers will then use the state's COVID-19 vaccine site map to find nearby locations and determine whether appointments are available and that they can help people schedule one. If no appointments are available within a distance that the caller can travel, callers will be offered the chance to be placed on a callback list for the mass vaccination sites, and they'll receive a callback when more appointments are available at these sites. We believe this resource will be a huge help to individuals who are over 75, who may not have access to the internet or have trouble using the website. However, we still recommend using the website if it's possible to do so, because you may experience, at least as this thing starts to get going, significant wait times using the call center, and the website will remain the quickest and fastest way for someone to find and schedule an appointment if they're comfortable using it. As we've been saying, vaccine availability continues to be limited by supply, which means it may take a week or so for people to get an appointment scheduled. But as we move through the distribution process, as the state receives more supply, as additional vaccines are approved by the federal government, we'll continue to open new clinics, add appointments, and expand resources to help people access vaccine appointments. Secondly, I want to talk a little bit about this new public awareness campaign that we're launching, which is called Trust the Facts, Get the Vax. The goal of the campaign is to promote the safety and efficacy of the vaccine and to encourage people to get vaccinated when they're eligible. To develop the most effective campaign, we spent a lot of time consulting with a diverse group of experts in public health messaging and outreach. We also conducted an extensive survey of over 1,000 Massachusetts residents, which oversampled people of color and communities that have been hardest hit by COVID-19. We wanted to know what barriers exist for people who are hesitant, who actually is hesitant about this, and how to break through the myths that are out there. The survey effort also included online panels, which served as focus groups to test various messages and messengers. We also looked at other public survey data that's available here in Massachusetts, as well as some of the national survey data that's out there as well. This $2.5 million public awareness campaign is all about using medical professionals to build trust in communities of color and other populations disproportionately affected by the virus. Because the data makes clear that this is the best way to reach those who are not sure about the vaccine. The TV ads will feature a diverse group of doctors who make clear that the vaccine is safe and effective and will urge everyone to trust the facts and get the vax. These medical professionals are essential to explain the importance of getting vaccinated and to help build trust in the science, the development process, and the safety measures that are in place. The main focus of the campaign is TV ads in English and Spanish that feature this diverse group of clinicians. The doctors represent a wide range of races, ethnicities, and regions of Massachusetts, and I want to first of all make sure we thank them for stepping up to help us deliver this critical message at this time. The first ad will air locally this Sunday. There's a game on this weekend that we think will probably draw a significant amount of attention, and it will run during the Super Bowl kickoff show that precedes the game. And starting next week, the campaign will be very visible across a number of other platforms. Animated videos will play on TV and social media platforms in 10 different languages: English, Spanish, Portuguese, Cape Verdean, Haitian Creole, Vietnamese, Russian, Arabic, Albanian, and both traditional and simplified Chinese. Additional ads will appear on other platforms like multilingual radio stations, paid social media and search ads in all languages, streaming services, and print advertising in English and Spanish outlets. And an American Sign Language version of the ad will also be available on the website as well. This campaign is a crucial part of our work to ensure equity in the vaccine distribution process. And as I said before, we're working with trusted partners like community health centers to launch vaccination clinics in communities of color across Massachusetts. But we recognize that ensuring access isn't enough. We need to reach out to people in these communities who may be hesitant about the vaccination. And we understand that some may be distrustful of the medical system or have questions and concerns about the vaccine. This campaign aims to reach people where they are and leverage trusted voices to help explain why the vaccine is safe and effective. We'll also need the public's health to bust myths that are out there as well. And that's why we're working with so many community partners to echo this message where and whenever possible. We're also asking the medical community here in Massachusetts to step up as well. And doctors, hospitals, and other medical professionals that people know and trust are clearly the best messengers, and we look forward to working with them to get this word out as well. In a minute, Secretary Sutters will talk a little more about the development of the campaign and also about the new call center. But first, we'd like to show you the TV ads from the campaign. I don't think we've ever gotten this right the first time on anything for the past year. I don't understand it. Honestly.
Guess we'll have to tune into the Super Bowl.
I guess you will.
All right, Mary Lou, why don't you talk and let these guys see if they can make what they were doing 20 minutes ago happen again.
Governor, Lieutenant Governor, everyone, still morning, good morning. This is the first in a series of public awareness and engagement that rolls out during this phase. We planned this campaign, as you heard the governor say, for phase 2 of our vaccination rollout as vaccines have become more available to more people. The multilingual, multi-channel campaign will run for the next 5 months, including on Telemundo and Univision, and as you heard, in multiple channels. And we're very pleased, in fact, that we were able to also make this happen in American Sign Language on a vlog. As the governor indicated, the campaign is grounded in research, building on the results of a survey of 1,000 Massachusetts residents that identified motivators and barriers about the vaccine and the kind of messages that may resonate. That research revealed that while 47% of those surveyed were confident in the vaccine and eager to get vaccinated, 53% had concerns that ranged from taking a wait-and-see approach to more hesitant. The survey data also confirmed that the most trusted sources was one's healthcare provider. Not surprising, communities of color and people in lower socioeconomic status were disproportionately represented in that majority who were taking a wait-and-see approach or more hesitant. Whereas the 47% early adopters, if you would, were eager to get vaccinated are predominantly white and more affluent. We tapped into the expertise of a 18-member external communications advisory group, public health marketing, communications professionals, representing large and small hospitals, community organizations, community health centers, local health, public relations, and trade associations in the development of the campaign. We very much appreciate their input and feedback and to answer the call to help. Down the road, as the general population rollout gets closer, additional TV spots will feature residents of the Commonwealth talking about the reason for getting vaccinated. And the call center. As the governor indicated, the vaccine scheduling resource line for individuals 75 and older is launched. The line can be accessed by calling 211, and it's immediately available in English and Spanish. And as the governor said, the staff have access to a translation line with multiple hundreds of languages available. We understand that while we experience a constrained vaccine supply, people are likely feeling a bit anxious to get their appointments booked. More vaccines are coming, and the news that J&J has been submitted for its EUA is promising. But for those with internet access, the best way for individuals in the eligibility groups is to book an appointment by visiting the mass.gov/COVID vaccine, and we encourage you to do that. The vaccine scheduling resource line is currently only for individuals 75 and older, and yes, they're going to ask you what age, what year you were born, and is meant to help individuals who may not have a family member, a neighbor, or someone to help them find an appointment online, or they do not have internet available to them. In order to best support these individuals, please, we ask that only those 75 and older who need this service use it. This last 10 months, much of which has forced all of us to change the way we interact with the rest of the world, has been particularly hard for older adults. The vaccine scheduling resource line is for them, to help them with the scheduling process and get one step closer to normalcy. In closing, I also want to thank our local councils on aging and our state's network of 25 aging services access points for all of their efforts during the pandemic, but particularly this past week as we were preparing for today's launch. They were sort of our secret shoppers in helping our older adults get, be assured and help them book appointments. And with that, I'll turn it back to the governor.
Questions?
Governor, moving forward, will this be for people 65 and over as well?
Meaning?
Meaning, right now, we're in the phase where people 75 and over can get the
Yeah.
vaccine, but moving forward, if someone is 65 and over and doesn't have good internet access.
Oh, yeah. No,
Will that work for them?
the call center is going to be available to support people. I wouldn't say all the way through the campaign. We'll see. It will depend to some extent on how much traffic it gets once we get out of some of the older populations and into some of the younger ones, but it will certainly be there for the 65 and older folks, yeah.
Is it one of the bills sponsored by Senator Lesser, I believe, said he wanted a call center set up 24/7 so people weren't sitting on hold. Why isn't this 24/7?
I think the main reason is we want to make sure that it's staffed appropriately and has the number of people we need to have on it to answer calls as they come in. And most folks are making calls for this type of thing during the day. And I think our view is better to have a ton of people on during the day when the vast majority of people are reaching out than to spread that community into the evening when call volume would be significantly less.
Is it 211 operators who are taking this call, or is this being transferred from there to then another, new vaccine call center?
Well, we've used the 211 system to do all kinds of things over the course of many years, and we've used it a lot during the pandemic to create helplines and support lines for people. Usually the way it works is there's a prompt, right? You'll get to the menu and there'll be a prompt on the menu, and then when you hit the thing you're looking for, which is in this case access to scheduling an appointment at a mass vaccination site, you will be, when you hit that, you'll be sent to the folks who are queued up to have the knowledge and the information and access to the state's website to be able to help you work your way through getting an appointment.
I guess I'm just wondering if the 211 system was already in place, why it took this long to stand up a call center.
Well, there are a couple of, remember, first of all, you need people who have a particular set of skills and capabilities to be able to serve and support people on this. And secondly, you need to train them and make sure that they're going to be able to do what you need to do, not just in English, but in multiple languages as well.
Governor,
Took a week.
obviously we relay a lot of criticism that you're getting from the public in general, but how do you guys take that information and turn it into policy or change, or kind of explain to people what you're doing with some of the things that you're getting criticized for? The phone center not coming out when the online system came. How does that turn into change for you guys?
Well, the first thing I'd say is that generally speaking, we've been spending the last 6 years on a whole variety of issues, hearing from the public on one thing or another, or hearing from legislators or hearing from local officials on one thing or another, and then making adjustments to try to improve whatever that particular experience is. I mean, we've talked a number of times about the Shared Streets program. That didn't exist. That came out of conversations that we had with local officials about the fact that they didn't have resources or a framework to do something about their downtowns, and especially about outdoor dining, access to parks, wider walkways, bicycle paths, all that kind of stuff. That program came completely out of conversations with them. Many cases, a lot of the incoming we get, wherever it comes from, gets worked through either our office or the office of the folks that are directly responsible for it, and then we work to improve the best we can. Sometimes we have to go to the legislature. One of the first things we heard when we went through this thing last spring was from the restaurant community that they needed more tools to do takeout. Some of those tools we could do administratively. Some of those tools we needed the legislature to act on. Thankfully, the legislature did. But I would say that the process of feedback from the public, feedback from other officials, feedback from experts in a variety of fields, I mean, that's kind of part of what you do every day around here.
So is it helping with the pandemic? Do you think it's directly making things better?
Oh, I think the feedback we get from outside folks is incredibly helpful. And, you know, if I were to sit here, I could go through a long list of adjustments and changes, modifications, reforms, new initiatives that have been launched ever since this began that involve feedback from the outside. I'll give you another simple one, which is over the course of the summer, one of the things we heard from colleges was, we're really worried about bringing kids back, especially if we don't have a rapid testing protocol and an ability to do something that's affordable. We took $10 million of COVID money, gave it to the Broad Institute to purchase, dramatically scale up their ability to do testing, and that created what became probably the most robust and most affordable rapid testing program at any college cluster in the United States. And we used to hear from professors and presidents at a lot of the colleges that they would talk to their peers in other states who would say, you know, I really wish I had something like that here. And this, you learn a lot if you know, my mother always used to say, you have two ears and one mouth for a reason. We learn a lot from people who provide us with constructive feedback of one kind or another.
So asking about vaccine distribution and the latest numbers, I think show decent news. 896,000 shipped to the state, 681,000 administered. Some quick math shows that 75%, and yet you look at the Bloomberg site where they keep score with all the numbers, including federal, and you're at 55%. Is the federal side the problem here with getting shots into arms?
The federal side certainly is an issue, but remember, they have a targeted universe they're chasing, and it's a targeted universe they have to go to. You know, skilled nursing facilities, assisted living residences, senior housing projects, congregate care settings. I mean, it's not, I think they've made 2 of 3 trips on skilled nursing facilities. The third shift on the skilled nursing. And then they've got, I mean, so that certainly affects our numbers, okay? And, but the other thing is, you know, depending upon what day of the week you look at this stuff, like, we were looking at this stuff last night, and if you go Monday to Sunday, you get one answer. If you go Monday to Sunday, you get one answer. If you go Sunday to Monday, you get a different one. I mean, they're all over the place. And what I want, and what I know the Secretary knows we want, is we want that percentage every single day, every single week to get better.
So I know we had a snowstorm this week. The last 4 days, on average, 15,000 shots a day. The previous 4 days, 30,000 shots a day. And the snowstorm was kind of a 1.5 day event. Why did that impact 4 days, or was it more than the snowstorm? Do you know?
I don't think that's true.
Well, I looked at your graph. It was like 14,000, 14,4, and then if you look at the previous four, up around 29, 30.
About, so I'm going to give you.
Maybe I'm looking at the wrong thing.
So we're now averaging about 20,000 a day. But so if I give you, doses shipped to Massachusetts providers was, so it's not going to match any other number you have, was 946,000. So we had 1.2 million doses, and we administered 713,000 as reported through February 4th. So we're hovering now. So our internal data, we're hovering between 58, 59%. You're never going to see that reported on the federal system that way.
At the bar chart, if you look at the last 4 days, it was around 14, 15,000. The previous four was around 30.
Because it's not yet all aggregated. It doesn't include the federal pharmacy program. It doesn't include the other sites.
Secretary, are you able to give us an update on any potential waste that you're seeing? Is that kind of
Wait, I thought you were going to ask me about the waste surveillance.
No,
I'm sorry.
waste of doses, and some people are showing up, and we know that they can't do that. Just messes up the whole system.
So the last time I looked, it was like 0.18% of doses that couldn't be used. But that was like last week's data, so I don't have this week's data.
Do you know what the ballpark is? That like a couple hundred or?
Oh, I can't. I'm sorry, I can't tell you what that is at the end of on a Friday. But we can figure that out for you.
Governor, I know I asked you about,
Where the call center is and who's manning it?
It's a virtual call center. So when you hit the 211 and it goes to dedicated folks who've been trained all week to take phone calls. It is so it's a virtual call center, and folks are located both in here and internationally. So it's so we're using 3 companies, right? We're using Maximus, who we use now for Mass Health. We use Optum, and we're using EHCon as the backup to us. And EHCon is a Massachusetts company.
And so many people are at home.
Oh, yeah, the call centers are all virtual. People work from home or, remote locations. And we have 600 people on the call centers today, as the governor said.
Governor,
Our
Um,
sister station at Telemundo just wants to know how many are fluent in Spanish and what other resources are being provided for the Hispanic community, if anything you can answer that.
So I think we'll have to get back to you because we were deliberately recruiting Spanish and English speakers. So bicultural speakers were very important to us. So bicultural, bilingual speakers in the contracts.
How are we doing for buy-in from other groups that have been in phase 1, the medical community, buy-in to the safety of the vaccine? Some folks early on were kind of hesitant. Are we getting more buy-in from those folks as well, not just the folks that you're aiming the TSA at?
So we've done, I've been very pleased with the buy-in on the skilled nursing facility, both staff and residents. Our residents was about 88%, and the staff numbers were in the upper 50%, which is different than what other states were showing, which was much lower. So we've been seeing an uptick on that, and I'm expecting, we're going to be offering, unlike some other states, so the federal pharmacy program is 3 visits. And on the 3rd visit, if staff have been reluctant on the 1st and 2nd, we will offer staff a first dose on the 3rd visit, and then we will need to work with the nursing home to make sure they get their 2nd dose. We didn't want, in the event that a staff in a nursing facility missed the first 2, it just seemed really unfair on the 3rd and last visit through the federal pharmacy program to not offer staff and residents a first dose. So we will be offering, they will be offered that, and then we will need to ensure that the nursing facility has the ability to arrange for the 2nd dose. And we feel like that's the right thing to do.
Are you surprised by that 50% number?
58%? But no, we keep seeing the increase. So we feel like the message is getting out. And I think as staff see that it's safe and their colleagues, we think, it's that, as the governor has said before, it's like boots on the ground. what's the experience of your colleague, your worker, and the like. And we'll continue to message this. We think that's very important.
This one's for the governor.
Good.
Some people are taking issue with a video of your Secretary of Climate Change saying that we need to break the will of people around energy usage. Do you have any response? And that you can't say that publicly. Any response to that?
I saw the video this morning. Lieutenant Governor and I both did. Followed up with Secretary Theorides. First of all, no one who works in our administration should ever say or think anything like that, ever. Secondly, Secretary Theorides is going to have a conversation with him about that. And third, one of the main reasons we didn't sign the climate bill when it got to our desk was because we were specifically concerned about the impact it was going to have on people's ability to pay for many of the pieces that were in it, which means it also doesn't represent administration policy or position. One other thing I do want to say about some of the scoreboard stuff. And first of all, we'll follow up with you specifically on some of your questions, Jonathan, because I struggle with all of the various ways people are counting and keeping score on this thing. And the federal program that you talked about is a great example of this, because we didn't get given, the pharmacy program that's doing the SNF work and the long-term care work got given enough vaccine that was part of our original allocation to vaccinate twice an assumed 100% occupancy of residents in the state's long-term care facilities. All right? Now, the state's long-term care facilities have an occupancy rate of about 75%. So that means just to start out of the gate, the allocation that they got was 25% greater than actually the number of residents we had in skilled nursing facilities. They also made an assumption about staff that was over the top. And as Secretary Sutter said, we've gotten about 55% of our staff so far in long-term care to sign up and get vaccinated. The federal number that you see nationally across the country is about 34%. So we are doing better there, but obviously we would like to get more. But one of the reasons why we took vaccine that was designated for that program and repositioned it to community health centers and pharmacies in places where we had folks who have been disproportionately affected in communities by COVID was exactly because of the back and forth we've been having with the feds about how much of the vaccine is locked up in a distribution channel that is oversupplied to begin with.
Is that helping bring your numbers up, you think? And you think the 75% you're at now is a decent number for the vaccine that you're getting to the state side?
No. We need to continue to get better and continue to perform better. And as I said earlier, there are 20,000 open appointments right now, next week, at the mass vac sites in Fenway, Gillette, and Springfield. And I would hope that we'll get to the point where, as we add capacity and as the feds add supply, that will make a big difference with respect to our numbers. It will also make a difference with respect to other people's numbers, but that's good. That's not bad.
Biden's administration is announcing it will deploy 1,000 troops to help with vaccinations. I know I asked you about the National Guard earlier this week. I wonder if you have any updated information from the administration on this. And do you think, I'll ask you again, if it's necessary here?
I don't have any updated information from the feds on this issue, at least no official communication. We continue to use the Guard to primarily support the protection and programming that goes on in our long-term care facilities, because that is in some respects still one of the greatest risks that people have with respect to COVID. And remember, we're talking now about a universe that's available to be vaccinated that has about 1 million people in it. If we're going to get into the Guard, it's going to be when we have a much bigger universe that we're looking to serve. Because at this point in time, we don't need them. We don't need their help right now to actually staff and manage the sites we've got operating.
Governor, a software developer who works for a healthcare company has taken it upon herself to make a website where it shows all available appointments at a glance on one page. She has the mass sites up now. She's working on more. I'm wondering if the state would consider implementing something like that.
Send us her name. We'll talk to her.
Yeah, but is the secretary started talking about that 10-day window you were just talking about, with that redirecting vaccine? Is that too big of a window? Are you guys comfortable? Is that being effective? Is like so?
It's been effective.
Do you think it should be less, just having it sit there for 10 days, or do you think it should be shorter?
So I'd say two things about this. The first is, the hospital community vaccinated a significant number of their employees, okay? But we made available to them the ability to vaccinate all of their employees. Many of the employees who have not stepped forward and gotten vaccinated, who work in hospitals and other healthcare settings, are people of color, okay? I want to make sure that as time goes by and as they develop a certain sense of comfort with this, that there will be vaccine available for them to get vaccinated at that point in time. In addition to that, many of the folks on the provider side are pivoting from vaccinating their workforce to vaccinating the patients in their panels who are over the age of 75 or meet some of the other eligibility criteria, so that those folks can go to what they consider to be their most trusted. They're making outbound calls to a lot of the patients they're most worried about who are eligible to make sure they get vaccinated. So, there's a little bit of a push and pull here, but there's no question that it's important for the healthcare community to have administered to shipped number that looks a lot like the rest of the Commonwealth's number.
Governor, how is the line of communications, has it improved over the last month with the feds, now that we have a new administration there? Are you getting the information you need so you can plan ahead?
I think, well, let's face it, they certainly know how important it is to the states that we get to the point where we have, more visibility than a week. They know we want to get to that point. They're still sort of working through. They know we would like to have that, and they would like to provide it. They are not there yet, but again, they've only been there for a couple of weeks. I do think, in particular, this J&J issue is a big one. I said this before, I'll say it again. If the J&J vaccine gets approved, it changes a lot of things about how fast people can get vaccinated for two reasons. Number one, it's one dose. And number two, it doesn't need a deep freeze for storage purposes. It doesn't have the same issues and requirements that the Moderna and Pfizer vaccine have with respect to transport. And if you think about trying to dose, the million people who are currently eligible, that's 2 million trips, right? One way or the other. And you can only do it in places where people can store the vaccine, and you have the issue that one of you asked about with respect to, one of those vials has 5 or 6 shots in it, right? So you thought with an assumption about how much of it you're going to use, which means you try to get really close to having the same number of people show up as the number of people you are actually assuming you are going to be serving each day. So there's real sort of sensitivity around appointments to vaccines, to making sure you only bring out as much as you actually can use. There are a lot of issues associated with this that are a lot more complicated than when you get into the world of a J&J type vaccine, which doesn't have some of the same higher order requirements associated with storage, use, distribution, and management.
Do you have a system that would put people on standby?
They have callbacks. They do have callbacks, and many of them, as they get toward the end of the day and they start seeing where they are and how much vaccine they've got out, if they think they have issues, they start making calls. And that's the reason why the unused vaccine rate is less than 1%, because people have been doing that.
Looks like you're doing it right. You want to give the another.
I'm only going to give them another shot if got one shot, one opportunity here. Okay.
Protect yourself and independent.
But you might have questions about safety. The same safety measures used for all vaccines were used for the COVID vaccine. Tens of thousands
solo han experimentado efectos secundarios leves. Yo no me vacuné para protegerme a mí, a mi familia y a mis pacientes.
Cuando le toque a usted, confíe en las pruebas, vacúnese.
The COVID-19 vaccine doesn't contain the virus, so you can't get COVID from the shot. You may experience things like muscle aches, fever, or tiredness, but these are most likely signs that your body is building immunity to protect against the virus. Learn more. When the COVID pandemic began, scientists had been studying similar viruses for years, so they had a head start creating this vaccine. They also started making the vaccine early, hoping it would be approved after clinical trials found it was safe and effective. Learn more.
Governor, one last question. Just your thoughts on the residents-only clinics. Do you think those are fair in certain towns and cities where they just open up to residents only?
Our goal here at the end of the day will be to create capacity to make sure that people across the Commonwealth have access. Now, the mass vaccination sites, of which there will ultimately be 7, or maybe more, depending upon where we get in the spring, are going to be the ones that have the greatest capacity and the most efficiency with respect to serving people in really large numbers. But there are going to be situations and circumstances around people who are shut-ins or folks who are at risk and eligible but don't have the ability to get to a local pharmacy or their doctor or whatever it might be, where some of these smaller operations can end up being very effective on a targeted basis in serving those populations. But, you know, the way I'm thinking about it at this point is the mass vac sites are going to have tremendous capacity and they can go very fast and very efficiently for people. We'll still have many retail sites available, whether they're in pharmacies or supermarkets or other locations where there are retail pharmacy operations in place. The regional collaboratives that have been set up are, for the most part, in places where you need to be distributed in a different way. Berkshire County is a good example. You know, Berkshire County is a lot of geography, right? You have to cover that doesn't have the same population density you see in other places. And the regional collaborative out there is working really well. Down on the Cape, largest percentage of folks over the age of 75 as a percentage of the total population. Having a regional collaborative down there makes sense. Franklin County, some of the same issues with respect to density that you have in other places. Good place to have a regional collaborative. Worcester County, a lot of room from the top of Massachusetts to the bottom, from New Hampshire to Rhode Island and Connecticut. Makes sense to have a regional collaborative. Different points, different places and spaces based on population density. So I don't have a problem with this. I think what we're trying to do is to create options for people. And to start with a proposition that if you can drive or take the T to get to Reggie Lewis or to Fenway or to Gillette or to Eastfield and Springfield or to the Danvers Doubletree, they have a lot of capacity, a lot of space, they move very fast, and they're going to do big numbers. But if you are located in one of these other areas where we're putting together a different kind of approach, go there. And if you have a pharmacy that shows up as one that's in the vaccination business that you're familiar with, that's in your community, or a supermarket, go there. I mean, the goal here at the end of the day is to try to give people options and to recognize that we are teeing this up when we get past what I would describe as some of the most at-risk populations, so that when we start doing general public stuff, we have a lot of different points of access for people, and hopefully at that point in time, a lot more vaccine coming from the feds as well.
Thanks, guys.
Thanks.
Thank you.
You guys have a nice weekend.